Hey, Fran fam, welcome to another edition of Life and Style with Francyne. I am your host, Francyne, in case you didn't know. I am really so pleased to have a very good friend of mine, none other than DeLorean Griffin. He is the
Hey,
plastic and
fam, welcome to another edition of
We'll
Life
have
and
to play
Style.
that. Let's see. Hold on, guys. There we go. So, welcome to another edition of Life and Style with Francyne. We have none other than DeLorean Griffin. He is a plastic and reconstructive surgeon in Michigan. And I wanted to say a little something because I kept getting it wrong and he kept correcting me. And I appreciate his patience in that. But he is the only African American male plastic surgeon in the metropolitan Detroit area. Am I getting that right? Did I get that right, Dr. Griffin?
Yeah, that is correct.
Yes, which I'm so proud of. I love to, I always love to brag on you on that. Every time I see you and I'm with somebody, it's like, he's a doctor, he's a plastic surgeon, which is quite an honor and just great to know you and know what you do. Talk a little bit about how you became interested in being a doctor and plastic surgery, because you could have chosen any particular discipline.
Right. Let me exit as distracted.
That's
So,
okay.
I don't know.
You knew you were in. You just came out of emergency surgery, so I'm glad.
It was a little quick thing in the emergency room. I had to take care of real quick.
Yeah,
it happens from time to time. It's not too.
Yes, you're a doctor.
Yeah, but it's not too many emergencies in plastic surgery.
Yeah.
But it feels good to be needed. So to I don't know how far back we want to go. Maybe college.
College is good. I mean, because someone watching may, college is good. Maybe a little bit before that, because you decided before college that you were going to practice medicine, right?
No.
Wow.
I didn't. I never met a black doctor until after I graduated from college. So I had no mentors. I had nobody to really guide me into medicine. It's just something I've kind of been interested in.
Yeah.
I actually started off as a graphic arts major at FAMU. And it's kind of evolved into something to the effect of me not wanting to be an artist as a career.
Sure.
And I recognized that early on. I actually gave up a scholarship, the full scholarship, to my mother's much dismay, that I gave it up, and I said I wanted to pursue a career in something medical. I didn't know what it was, so I became a biology major. And
wow.
My cousin was probably watching right now. Is one of the greatest influences, Erica Hill.
Hi, Erica. Yes, I met Erica.
She just got into town. She's staying with me. We got some challenges ahead for both of us.
Okay.
Coming up. Maybe we'll talk about that later. But so she was one of the biggest influences as far as convincing me that I had the aptitude to become a physician, because I didn't have a lot of role models, even in college. The biology department was kind of in a state of disarray.
And where did you graduate from, Doc?
Florida A&M University.
Okay.
That's the plaque right there.
Yes, the Rattlers. Yes.
The Rattlers, that's right.
I know a few. They're awesome people.
Yeah. So, from there, I kind of found a mentor, and took the MCAT, which is the exam you have to take to get into medical school. I just took it twice. Took it a second time, and only for my score to only go up 1 point. But I said, you know what? I'm gonna try to apply. I did decent, average probably. Had good grades.
Sure.
So I applied and got into Wayne State here in my hometown. And from there, and I've been here ever since. And that was in 2002.
Yeah.
So
go ahead.
No, so from there, you like you said, you can pick any specialty you want in not any that you want, but
yeah,
getting a particular interest in whatever field you may desire to go into, whether it's pediatrics, OBGYN, surgery, plastic surgery, neurosurgery, orthopedic surgery, whatever,
sure.
radiology, whatever. So me, I kind of found my niche early on because everybody said, well, you're this artistic guy. Why not go into plastic surgery? That's a very artistic field. Yeah, let me see what it's all about.
Sure.
So in my third year, I latched on to a mentor, Dr. Balakrishnan, who showed me the ins and outs of the reconstructive side of plastic surgery, because we all think that plastic surgery is just facelifts and boob jobs and butts and liposuction and tummy tucks and all of that. It goes well beyond that, and that's
Oh my God.
yeah. So
That's fascinating about plastic surgery, because we just see what's popular, but you literally change lives from someone that was devastated by an accident, a fire, or whatnot. That's why I could see why you chose that particular field, because it is an artistry. So it's almost like your gift was being changed, being redirected into an area. I mean, you could have been a wonderful artist, because you are. I've seen your work. But the lives that you've touched with your hands, that's what's so fascinating to me. So if I'm a fan, so this is, and this is my show, and I can be a fan. So it's, the discipline that you chose really chose you, do you think, to some degree?
Yeah, you could say that. You could say
Yeah.
that. It was a lot of, I guess, if you believe in fate, a lot of things fell into place to where I could not only, go into plastic surgery, but also somehow, practice in my hometown.
Yeah.
And, it kind of took off from there. So before I went into plastic surgery, residency wise, so you do med school, everybody goes to the same med school, then you decide to become a surgeon, or, in my case, had interested in plastic surgery, but there's several pathways you can take to get to that promised land. And I decided to go the general surgery route. So I did a 5-year general surgery residency prior to undergoing another 3 years of plastic surgery training, very extensive and rigorous training. And from there became a board certified plastic surgeon. And here at St. Mary Mercy Hospital, Livonia, that's, I was hired right after residency.
Wow.
It becomes, somewhat of a dream job at this point. I've been in practice for, it'd be 5 years and 2 days or 3 days.
Congratulations.
Thank you.
Erica is watching, as well as Tiff. So do you want to talk a little bit about what you were talking about earlier? Do you want to, go in there?
Only if my cousin is comfortable. I can't see any of the comments. I had to.
Okay. Okay.
Let me see.
You know what? We can go on, and if she chimes in and says it's okay, we can do that as well. Because I know we've got another engagement, and we already said, I could probably have you for 2 hours, but I know I can only get an hour, and I don't want to. I want to stop this at a hard pass, at a hard 5 o'clock pass.
So in practice, I do the full gamut of plastic surgery, both the reconstructive and cosmetic side. I'm probably at this point 60% cosmetic and 40% reconstructive. The reconstructive side, I do the things you talked about. Matter of fact, doing that tomorrow, fixing somebody's face who was in a car accident, repairing his mandible. So there's that. There's, kind of skin lesions, burns, wound care, breast reconstruction for cancer. And, that's the reconstructive side. So on the cosmetic side, which is kind of, taken off in the past few years, I do the tummy tuck is my most popular operation.
Yeah.
I also do the butts and liposuction and breast lifts, breast augmentation and lift, breast reduction, some facial stuff, not too much. I don't like to spread myself too thin.
Sure. What is your typical client base as it relates to race? Is it diverse, or do you see more?
Yeah, I mean, we're in Livonia. Livonia's, mostly Caucasian, so it's like when I first started, my initial client base was, the population that's around me, and who I was getting referrals from until I got my name kind of out there. I'd say right now it's probably across the board, maybe 40% white, 40% black, and 20% other. Mexican, Arabic, Asians.
What has been one of the most challenging, and I don't want to violate HIPAA, but what are some of the challenges that you face, or one of the most challenging surgeries? Let's start with the surgeries first. What was the most challenging yet fulfilling surgeries that?
No, I don't know. There's so many challenges.
Yeah.
Definitely it'll have to be one of the reconstructive operations, repairing. When you're dealing with the face, you have so many intricate nerves that are affected. So it's like even a facelift can be challenging if you don't know your anatomy. No, I'm not saying I don't know my anatomy, but the anatomy is there. You have to be aware of it. Sometimes, you have to play that accordingly to avoid complications, knowing where this particular nerve is, facial nerve with its 5 branches. And, on the reconstructive side, repairing a mandible, when your jaw socket is up here, you got to go through many layers and avoid many, important structures to avoid injuring them. So those are challenging cases. Anytime you're dealing with somebody with extreme, I'm part of the comprehensive bariatric program here. So when patients lose their weight after gastric sleeve or gastric bypass, whatever have you, I'm the one tightening them up. So that could be challenging at times. The challenge is, setting realistic expectations.
Sure.
So basically, the patient comes to my office, and you have to establish what you can do for that patient in a realistic way. A lot of patients will come to me and say, "Oh, I want to look like, I don't know who's popular nowadays, Meg the Stallion." When you don't necessarily have that anatomy to pull out, you have to do what's, you have to enhance a person in a way that's going to still maintain their own identity. You know what I'm saying? You can only do so much anyways if you don't have the bone structure. Fat is is distributed differently. Your skin type everybody's skin type is differently. There's a lot of variety there. So you have to be realistic. You have to tell the patients the truth. A lot of there's some plastic surgeons out here promising things to patients that they really can't deliver, or it's going to be harmful in the long term, because you certainly do too much in a lot of these cases.
So you have to, I would imagine you have to do a lot of psychological intervention as it relates to patients wanting you to recreate what they see, the Barbie doll hips and
right.
If you're not physically created that way, you're also interrupting the integrity of your body, and I would imagine some plastic surgeons will try, if you've got the money.
Yeah, and so that's where the integrity comes in. You know what I'm saying? It can be tough at times. Patients come in, they're popular people, and they're dangling this money in front of your face, and they're not good candidates for stuff. But you have to be honest with them, saying that either it's unsafe, or you need to lose weight. You know what I mean? First, because you're not going to be happy with results. If patient's not happy, I'm not happy. So,
Sure.
So that's one of the challenges, I think. Also is, I think education. I think, the American Society of Plastic Surgeons, an organization which I've been a member of since I was a resident. We've done a good job at kind of promoting our field in a way that promotes safety and promotes patient awareness about, what do you look for when you look for a plastic surgeon?
Sure.
Do you know their qualifications? How many of these surgeries have they done? Are they board certified? Or are they just board eligible? Or are they neither? Because, this, I'll be honest, I mean, this is a lucrative field and everybody wants a piece. You got dentists trying to do plastic surgery. You got OBGYNs, doing plastic surgery. You got a couple of players here in Detroit that are not trained the way we are trained. I just told you, we undergo rigorous residency training. I did 8 years of residency prior to going into practice, and there's people out here doing weekend courses and calling themselves board certified, whatever. They're not really qualified to perform these surgeries. And part of my mission has been to educate the public about that.
Yeah. How does that make you feel, Dr. Griffin, to know that you have weekend warriors out here doing something, first of all, that puts a patient at risk, not just to possibly live with botched surgery, but also potentially die?
Yeah. I mean, it's a constant battle. I mean, you're battling against people without the qualifications, wherever they may be, just doing stuff out of their office and advertising themselves as such. Then you're dealing with, people that are going overseas, and I mean, a lot of people go overseas and they have plastic surgery and they do just fine. But at the same time, you got to understand, you're getting major surgery. A lot of times they're just putting you in a halfway house over there. You don't know what type of post-operative care you're getting. By the time you get back to the States, you have a complication that occurs after you come back.
Yeah.
A lot of times people are reluctant to, take care of you after that. So there are a lot of challenges. So on the one hand, I'm kind of flattered because the saying goes, imitation is the best form of flattery, right?
Yeah.
So, everybody wants to imitate a plastic surgeon, when I'm, with a real deal. So it's it can be flattering at times. At the same time, these guys that are performing these botched surgeries are also providing extra work for us. So
yeah, because you have to do the corrective surgery.
Yeah. I've seen there's one particular guy here in Metro Detroit. I won't name his name, but he said he inadvertently sends me a lot of patients that I have to fix.
Yes, I'm sure. I'm sure. Speaking of botched surgeries, I've always been fascinated, first of all, with watching surgery on television for some reason, specifically plastic surgery, which takes me way back and probably going to date me to the doctor that had a show. Can't remember his name, but he had a show, and black guy, did surgeries.
Yeah, Jen Adams.
Yes.
On Kanye West's mother. Yeah.
Yes. And that was the caveat. Unfortunately, her life, and what happened at the end was a caveat for a lot of us if we were even thinking about surgery. Because I've, looked at different things and looked at different doctors. And if you had the money, they were willing to do whatever, And so thankfully I was able to think about it and say, you know what, they will try anything. And if you've got the money, they will keep cutting on you and cutting on you. And the thing about it is once they cut away, you can't correct it. It's gone.
Well, in her case, her life was gone.
Yes.
So that kind of makes me double back to, integrity. She had been already turned away by 2 other plastic surgeons because she had a heart condition.
Yes.
wasn't deemed a good candidate by her cardiologist for surgery. And, you know, and here she comes doctor shopping.
Yeah.
And, you know, doctor, you know, that particular doctor, he took her case on, and that's the consequence. You have to, so you have to, once again, I'm going back to where I'm saying, you know, you have these patients. Oh yeah, that's Kanye West's mom, and she's dangling this money in front of your face. Oh,
Yeah.
but it was our condition. Oh, maybe we can pull it off. You got to go back to your original oath that we took to not do no harm, because ultimately that was the consequence. She wound up dying.
Yeah.
As a result, when in fact the writing was on the wall. She had the documentation showing that she had this heart condition, and you know, and that's the you know, that's the dilemma that we have as plastic surgeons. We have an office to run. We have to maintain overhead and everything else, but we also have to perform safe surgery. So
I'm going to take a look. Letitia Davenport Azell says, family blessed hands given by God. Erica is watching, her and Tiff, your wife. You are still an artist per your work. Then Loretta says, can you provide a link to or pictures of your work? You were doing that at one time, I remember, which was amazing and a lot of great information, but how does that work now?
Well, the way it works around here is, so, you know, I'm not in private practice. I'm a hospital employee. They provide me with an office. They provide me with all of my malpractice. They provide me with the ancillary staff that I need. And that's one of the perks of being employed by a hospital. I get a salary. So during the whole COVID thing, you know, I didn't take a hit the same way a lot of the private guys would have, because, you know, they're ready. You stop operating, the paycheck stop. So one of the benefits of working for the hospital was that I still had my same paycheck, and even though I wasn't working as much, you know, that got me over. So, you know, there's a lot of the advantages there, you know, and that comes with some disadvantages as well. You know, you give up control as far as how you're able to advertise and how you're able to, you know, put your information out there, you know, working for a Catholic organization can be, you know.
So we can really.
So, but you know, we can address her question maybe in
Okay. Okay, Loretta, did you get that? We can do that offline as far as addressing any concerns you might have about plastic surgery. And that's a great segue. Are you happy that, because some would say, man, you could be cleaning up, you know, why aren't you in private practice? Because, you know,
right. You're probably every
plastic surgeon, you know what I mean? You're very every time I see you, you're like 6'6".
No.
How tall?
6'4".
6'4".
Yeah.
Okay, 2 inches. You know, I see you, you're 6'4", you're standing there very unassuming, you know, real cool, quiet cat, but very caring with your patients. So you could really seriously clean up in private practice, but yet chosen to work with a hospital.
Yeah.
That way. So
I mean, for me, you know, I can't say that I won't one day. I don't have aspirations for, you know, going into private practice.
Yeah.
It's just that, you know, I've been able to build something here.
Absolutely.
A network in the absence of very much advertising. I've been able to, you know, really build a practice here. And I built it, you know, relatively quick, you know, just by word of mouth. You know, I think, you know, I'll probably be putting a post out talking about how I've been able to build this practice in less than 4 years when the average plastic surgeon, it takes about 5 years to build their practice. And, you know, I like working with residents. I like the reconstructive side of it. I like getting that steady paycheck, you know. I get reimbursed fairly.
Yeah. So do you find that being able to build a practice in less time, do you think that had a lot to do with, you said you liked working with the residents. Do you think it has a lot to do with your character and who you are? Because not all doctors are necessarily the best doctors.
Right.
You know,
You're certainly right. You can be a very good technical surgeon. You can have the highest, you know, come out of residency with the highest exam scores and still not, you know, if you don't have that bedside manner, that's
baby.
It's a turn off. I don't know. Some patients don't care. They're going to go to some of these guys that, you know, I wouldn't let touch my family with 10-foot pole. So,
yeah.
So I think that, I mean, you know, that it's a trifecta. For me, he was doing good work and everything else kind of fell into place. Being a compassionate doctor, responsive, you know, being a doctor that a lot of people feel comfortable with. And I think, you know, practicing in the hometown in the D is also in the area.
Yeah.
Been a boon too, because it's just like that word of mouth was able to take off.
So what does your mom think now that
you might be watching? She called me early. Sorry, Mom, I couldn't answer. I was stopping bleeding in the operating room.
Yeah.
If Tiffany is if she could send my mom a message and let her know that. That's why I didn't answer her phone call.
Oh.
So she was initially disappointed that I vanquished my scholarship to do a career in medicine, because she saw the artist that I was, and maybe she thought I was just going to be a biology teacher, but this thing kind of exploded. I think she's pretty okay with it now.
Yeah, I'm sure. Well, kudos to your mom, because I think it's important for a lot of parents to see a child's bend and push them that way. You know, the flip side is she could have had, you know, you could have been wanting to be an artist and had parents, you know, your mom wanted you to be a doctor. So isn't that weird that happened that way, where it's like she wanted?
Yeah, I mean, no. So you got to support your kids' dreams.
Yeah.
When you know, when they're not interested in something, you also have to listen to that too.
Absolutely.
And I'm going to do the same with my kids. I'm not going to, pressure my son or daughter to go into medicine. You know, especially the state that we're in now.
Yeah. The activists that they are. We saw the pictures of them in the protest. They're so cute. Yeah. What are some of the what does DeLorean want to do? Thank you, Loretta. She said she shared this video with some couple of groups that are plastic surgery related. What are some things that DeLorean, because truly you come up against a mandible situation, and I know that has to take a lot, at least for us who are not gifted at all in that area, where your mind has to go somewhere where it's like you're thinking, how am I going to attack this? And maybe attack is not the best word, but how am I going to approach this?
Right.
What am I? Your wheels are turning, and you're already thinking about the finished. That to me is fascinating. So I know that takes a lot. Well, maybe it doesn't take a lot for you, but that has to be. But it probably calls on a lot. And so, are you the type that works hard and plays hard? I know the answer to this question, but for people that
hey, don't put that out there.
Don't know you, you know,
if you see me out, and you know, I see my patients out on the street all the time. It's crazy. Probably about two to three times every time I step outside. But
You don't see them in East Africa.
say what?
You don't see them in East Africa, so you play a little harder.
Oh, go on a vacation. Oh yeah. I mean, yeah, I feel like I deserve it. You know.
Yeah.
What do you think?
I think so.
Yeah.
I think so. But what do you do outside? So what are some other things that you do? First of all, international travel is certainly a great way to pay yourself back for the work that you do. And thank you for being, one of those ones in the community, especially with all the health disparities and things that we come against. It's
Yeah.
good to see someone out there in the community that we can trust as African Americans.
Yeah. I mean, it sounded like your first part of that question was how do I approach a particular patient or whatever.
Yeah.
And it comes with the training, and I got very good training downtown Detroit. I saw pretty much everything I needed to see. It's not a lot of cosmetic surgery in Detroit, obviously, but I got the opportunity to train with the best plastic surgeons in the suburbs as well, at Beaumont, Providence.
Yeah.
At their private offices. So when it comes to a particular approach, once you see a patient and you're able to individualize them, see what their needs are, it becomes I'm not gonna say easy, but it facilitates that approach when you're able to create an algorithm for that patient based on their needs. You know what I mean? And that's both on the cosmetic side and on the reconstructive side.
Sure.
Because they're just anatomical differences between all of us, and you have to, tailor that to that particular patient. Now, as far as travel, well, here's what I'll say. So my intentions this year, before COVID just ruined the entire year of 2020, was to go to well, I had a medical mission planned to Nigeria in April.
Oh, wow.
The crazy thing was there was only one case in the entire country of Nigeria, and they canceled it. And that was long before this COVID thing even blew up. This was February.
Yeah.
So there was some writing on the wall there. Then I had intentions to, I was going to do plastic surgery there. I was really looking forward to that trip. And I guess, there's opportunities in the future when things open back up.
Yeah.
But on the play side, yeah, I like to travel. I didn't get a chance to travel through residency or med school or even undergrad. So, now I'm playing catch up. Everybody else has been traveling the world in the 30s, 20s. So,
how has your practice been since, because you were out did you have COVID at one point in time?
Did I have it personally?
Yes. Did you have any? Oh, you did. Okay.
I got tested. I was negative.
Okay. And but you were quarantined.
Not quarantined per se.
Okay.
I stayed home. I listened to the stay-at-home orders for the most part.
Okay.
My wife is giving me the side eye right now because I went and got my hair cut. Hey, whatever. So, I stayed home. I was out of work. I wasn't out of work. I kept working.
Yeah.
So I still did emergencies. All my elective cases were canceled or postponed.
Okay.
I did a lot of soul searching. Actually, it was actually a good pause for me because I was getting kind of overwhelmed with the work I was doing. I'm getting right back to that point now. But
really,
I was still working, and I was still seeing patients. I saw patients via telemedicine, so we did Zoom consultations.
Now, what do you think about that? That the whole, because obviously COVID has changed everything and how we approach. I was reading an article or the headline of an article where you may not even be able to necessarily drive to see your therapist. And in my mind, I thought, good, no driving, because I would love to be driven everywhere instead of driving. So for me, that works. For someone else, telemedicine might be missing. They might be missing that personal,
Yeah.
close face to face. Whereas this is perfect for me. Tell me what I got. You know what I mean? So, but what do you think?
Obviously, in some disciplines, you're going to be able to take advantage of telemedicine more. For me, it was still good because I got to eyeball a patient. I had patients send me pictures anyways.
Yeah.
You think, Doc, what do you think I need? But obviously, in the absence of being able to do that actual physical exam,
sure,
patients, there was some shortcomings, but it was good to actually keep that interest generated throughout the whole COVID situation. So I've been back to seeing patients since early May.
Okay.
And playing catch up that way. Now I'm seeing those patients that I saw by telemedicine in person. And I already have their history. I got an idea of what they may need. As long as that corresponds with, what I saw in their physical exam in person, then, it worked out. I think. So I'd still do it. It actually is good for a lot of out of town patients that I have. They can call in and we can get an idea of what they need. We talk via Zoom to see what they need, and they decide to come to Detroit area. I'm the man.
Yeah. What you said something. It was about. So what did you learn through your soul searching? What will you do differently so that you are not as overwhelmed as you were and had gotten to?
Right. Yeah. I mean, it's very easy to just spread yourself thin because you got your career, you got I have a side business, I have some property, and then you got your home life, and then you're still trying to appease. People ask me for artwork sometimes, sometimes you just got to be able to say no and stop appeasing everybody when you got to. It's time to take care of self.
Is that hard for you to say no?
No. I mean, I've gotten better at it. I've gotten more creative in saying no in a polite way. But I can't draw your kids for $20.
Because you love your first love, so you still.
Yeah.
And it's interesting because every time something, I find that it's always kind of event driven, or it's timely. You're inspired a lot from your experiences, a lot from what's happening now. Do you find that is a release for you? Because yes, you do exercise your art in this discipline, but
for me, it's all for me, obviously, I gave up the scholarship. I was never in, becoming a true artist where I actually, had my pieces in galleries and stuff like that.
Sure.
I've actually have had my a lot of my pieces have been around the Detroit hospitals.
Okay.
And one is hanging right now in the basement of Detroit Receiving.
Wow.
I did for my attending, but for me, it was always never something I could see myself making a career out of. Shout out to the artists, because the true artists that know what it feels like to be a starving artist. That's just something I wasn't willing to go through. So for me, it's always been, I'm good at it. I taught myself how to do everything I do, and it's just therapy for me. So it's therapeutic, it's cathartic, it's a nice release. But yeah, and I kind of parlayed that into a plastic surgery career.
Yeah.
Imagine that. So, there's a lot of us actually that are what we call dual cortex, or able to excel in science and art, especially in plastic surgery. Another one of my mentors, God rest his soul, Dr. Vias, he was a sculptor.
Wow.
Yeah, he was my mentor. He passed away probably about 3 years ago. But he would sculpt polar bear. He would go to the North Pole and photograph these polar bears, and then had these beautiful sculptures, and he would have them cast it into brass and stuff like that. Yeah, I want to one day do that. And he had like a big portrait in Providence Hospital of it was Indian, so he had this Indian wedding, which extended across this entire wall in Providence. So I'm like, yeah, you're my idol.
Yeah. When you said dual cortex, does that mean you operate well in your left and right brain?
Yeah, because I mean, we've established that our brain the hemispheres of our brain serve different purposes. We have our scientific side, our rational side, our logical side. Mm-hmm. We have our creative side, and most people fall on one side or the other. And I think that individuals such as myself have been able to play both sides of the brain hemispheres co-dominantly. So I don't know. At least that's what they tell me.
You have to have a lot of people just rooting for you, and like myself, and really just taken with the work that you're doing. How does that make you feel?
I mean, it's rewarding. Like, I stay, I'm a humble individual. I stay grounded.
Yeah.
That's why you'll see me at the cookout, you know what I'm saying? Playing spades. I don't look at myself like any type of demagogue or something like that, but
yeah.
But yeah, I feel the support. It's kind of like heaven, knowing that you got your people behind you.
We have a question, Doc. It's okay, because I know we were going to have some questions. Have you discussed keloid in black skin? Do you see that a lot? And what's your feeling on that as far as?
Well, let's define a keloid, because most people that come to me saying, "Oh, I got these keloids," they don't really have keloids.
Okay.
So a keloid is an overgrowth of your scar outside the margin of the original scar. So it appears as a growth, it appears as a tumor. Most of the time, people are either talking about a widened scar or a hypertrophic scar, which is a raised scar. We treat them, similarly, but a true keloid, my approach to those are to, African Americans have the highest rate. People of color, have higher rates.
Why is that? Is there?
So we talk about black knot cracking, the reason why, African Americans age kind of better than other races is because of the amount of collagen we have in our skin. So type 3 collagen is abundant in a lot of African American skin, and therefore can overgrow when you have a wound that's healing. So
there's different types of collagen?
Yeah, so we all have, so you have type 1, type 2, type 3 collagen in the healing process. You have type 3 collagen, and then it gets replaced by type 1 collagen later on. It's all technical stuff.
Sure, but I didn't know that.
Yeah, so it's part of the wound healing phase. So the thing is, you want to target, if you're known to have keloid and you're cutting out keloid out, you want to target that keloid at that particular phase, the inflammatory phase. You want to tone that down. So I like to inject dexamethasone. Some people, which is a local steroid, that you inject. Historically, I think people have injected Kenalog, but with African American skin, it can cause depigmentation. So I stopped using that. You don't want to leave white blotches on people. So I use dexamethasone, which is another steroid. Inject that, and then see what happens. I think you can decrease the rate of keloid, which is a higher rate of coming back, to about you can decrease it about 40% if you do those two things. So let's say you do those things and it comes back. Then you do the same thing over again. You cut it out, inject steroids, and then you implement radiation. And in that case, you can decrease the rate of keloids not coming back to about 15%. So that's my protocol. And most of the time, it's the ears, it's the chest, shoulder region.
Why is it typically in those particular areas?
We don't know. And then some people was there, and then like my wife Tiffany, she keloid. She had a tummy tuck. She has a keloid scar. She's been waiting for me to take care of that too.
Yeah.
She doesn't keloid in her ears, but she keloids down there. So we just don't know why.
Yeah, that's like, I still have this chicken pox scar. I tend to scar. And I think that was one of the reasons why I had said, oh, no plastic surgery. Because, I wasn't willing. I didn't know how I was going to react with keloiding, knowing that I have a tendency to do so.
Right.
So that scared me a little bit.
So to double back, preventing them, we always talk about what do I use? Do I use Mederma? First of all, don't use Mederma. Mederma is terrible.
Don't use Mederma. No Mederma, guys.
Mederma. Vitamin E, I guess, is okay.
Yeah.
Cocoa butter, I think, is even better. You got to massage the scar, try to get it to soften up, flatten it out, because that's the ultimate goal, is to relieve the tension on a particular wound at the surface level. The best product to prevent keloids or even raised scars or ugly scars, silicone products. They sell them in CVS. The particular brand that I like to use is Scar Away. Comes in a patch. It also comes in a dispenser with the roller balls on it. You can massage it in. You know what I mean? So then that reduces the tension. It breaks up the scar tissue, softens the scar, can flatten it out.
Scar Away.
Scar Away, or you go to any CVS, Walgreens, look at your silicone products. Stay away from Mederma.
Stay away from Mederma. So are you saying that I could not, and I'm not asking for a diagnosis like on the spot but it's a potential where I could have surgery of whatever sort, and knowing that I could be a candidate, but and you would just have to take a different approach if I was somebody that keloid.
Yeah, I mean, and we don't know. Sometimes we don't know who those patients are. We just have to, because I'll tell you, I'd repair every incision the same way, using fine monofilament sutures, non-inflammatory sutures. And if I close 5 people, I'll get 5 different scars.
Yeah.
With a fine line to a raised keloid. There's nothing you can do about it.
Yeah.
You come across that, you just have to plan accordingly.
Now, I've got another question for you, Doc. Hi, Nicole. I've heard about breast lifts without implants. Have you done them, and how do you feel about them?
So the way the trends have been going, because there are always trends in plastic surgery, right? Back in the 80s, everybody wanted a big shelf. Pamela Anderson. Nobody gets those anymore, right?
No.
So some people like that, but so most of the time it's gone to the point where most people don't want implants. They just don't want the foreign body. They've heard about these things, maybe it can cause some type of lymphoma, and we've taken some of the implants off the market because of that.
Sure.
Breast implant associated illness, which is like a chronic fatigue syndrome associated with it. It's very rare, but even then, a lot of patients are apprehensive. So most of the time I do a lift. Let's back up. So in my population, my population is a little older. You're already a mommy, you probably got teenagers. I really don't get the young 20-year-old with the straight implants. I don't get that patient population. I'm cool with that.
Yeah.
I posted about that the other day too. But for the most part, most people just need a lift, especially after they breastfed, they're deflated, or they lost weight, or both. So they say, most patients that come to me say, I don't want an implant. What can we do? Well, I use a technique that kind of, if you're doing a lift, it can make it even look like you have implants. And if you're dead set on having more volume, along with projection, then I would recommend an implant.
Sure.
If I absolutely didn't want one, we can even do fat injections. So
okay.
Same way they put, we put fat into the butt as fat grafting. we can do that with the breast as well.
What's the, I have another question from Odetta. What about vaginal reconstruction surgery after surgery?
Yeah, I'm leaving that one alone.
Okay.
Yeah, one of your friends brought that up because she had, right? Remember we talked about that on your post that one time?
Yeah.
We said that that's part of some male hierarchy, male patriarchy or something like that. No, a lot of women desiring that. They want us, they either have large labia or they want tightening after, having children.
Sure.
With, there are a variety of techniques. I'm not crossing that.
That's not your
Why,
that's not your job.
It's because number one, I do enough stuff to where I don't need to jump into any other things. And I see.
Is that a viable procedure? I've never heard of.
No, there's some people that are good at it, but there's some people that are very good at that.
Okay.
Some people that are doing it. I'm just not gonna cross that road because I know that in that area you try to repair something, you got a lot of moisture, bacteria. It's not going to heal 100% properly. And the last thing I want is a patient coming to me telling me I can't have sex, blah blah blah. It's not for me personally, but I know some people that do it and they're very good at it.
What about I knew this was going to happen because I know you got to go, but we're going to, because first of all, we love you. And how do you feel about non-surgical lipo? Does it really work?
I found
freeze it or something, or they put this laser.
No, I'll tell you. Okay, so there's so many different ones.
Yeah.
Probably the most popular one is cool sculpting, but you also have laser lipo. Every 2 months or so, there's somebody asking me about some new minimally invasive ultrasound or laser lipo or something.
Yeah.
None of those things actually eliminate the fat directly.
Thanks, Gwen.
So cool sculpting, I think, is probably the best out of all of the non-invasives.
Sure.
Freezing the fat, the ice crystals will penetrate the fat cells and cause cell death, and your body kind of reabsorbs it. Those type of things are good for very small areas. They're not good for large volume lipo. Or if you have large areas that you want to get rid of, it's not good for that.
So you should go for a tummy tuck?
No, I'm saying that you should go for traditional liposuction.
Traditional liposuction. You know what? I was jumping. That was my question.
And sometimes you need that too. Sometimes you need a tummy tuck.
Yeah. What about skin removal? I'm a bariatric patient and have tons of loose skin. Mm-hmm. And we talked about that, Lauren. Go ahead, Doc.
So yeah, that's my specialty. So I work with bariatric patients more than any other type of patient across the board. So that's what I do. I do arm. I'm doing arm lifts. I do breast lift. I do tummy tucks. Sometimes you need a body lift if you have skin that hangs in the back as well.
Yeah.
All of those thigh lifts. I hate doing thigh lifts, but I will do them. For the same reason, the vaginoplasties, they fall apart. Your thigh lift is going to fall apart too because you got that moisture in your groin area, and But the tummy tucks, I do quite a bit on them on bariatric patients.
Okay.
So,
question in relation to that. Go ahead.
I'm sorry. So there's a timing thing there. So there's a medical necessity part of it, which insurance will pay for. Just information on that. If you're having rashes and you can document that you've used some type of cream powder, then insurance will pay for a portion of your tummy tuck. If you are a weight loss patient, you have to have lost 80% of your ideal body weight and have plateaued for 3 months. You have to have a stable weight, have to have rashes, and they'll pay for part of it. It makes it a lot less expensive for a tummy tuck.
Interesting.
But they will not pay for the entire thing. They won't pay for the making it look pretty because insurance companies don't care about how pretty you look, right?
So that would be a separate procedure to be paid for out of pocket.
It's an extension of the same procedure, but it's an extra cost.
Got it.
You
Okay.
got to have a pocket to move your belly button and tighten the muscles up. Because just like most women, you know, especially if had children, the six-pack muscles are separated. We call that a abdominal diastasis.
Mm-hmm.
You have to repair that in the operating room by restoring that anatomy to where it was.
Has he spoke to maintaining your new shape after plastic surgery?
Maintaining what now?
Your new shape after plastic surgery.
Right. So, you know, I alluded to not plastic surgery not being a quick fix, so to speak. So, you know, I encourage, you know, maintaining healthy body weight, diet, and exercise, all that. I encourage that going into it.
Mm-hmm.
I encourage you doing everything you can to prevent plastic surgery up until the point where you feel like I've done all I can.
Sure.
And now I feel like I need it.
Sure.
Because that creates the healthy habits on the front end, which extends to the back end, and better results, higher satisfaction, you know.
Yeah.
To where I'm satisfied and the patient is satisfied as well.
Do you perform plastic surgery on patients with severe HS? I'm not sure what
Severe what?
HS to recover severe scarring. I'm not sure what HS is.
Hypertrophic scarring? Hypertrophic scarring, maybe? I don't know.
Maybe. Yes. Yeah.
Hidradenitis suppurativa. Is that what it is? You gotta be more specific.
I think it's the one you just said. The
hidradenitis. Yeah.
Yeah.
Yes, I do that surgery as well.
Okay.
That's part of the reconstructive stuff.
What that is, because I've seen that, and it tends to be a lot more with African Americans. At least I've known some where it's, you know, there's like a growth or something.
Yeah, so I think it affects all races. Pretty much, I've seen it in all races.
Okay.
I've seen it more in African American. We live in an African American, you know, region, but
right.
So basically, what hidradenitis suppurativa is where you have inflammation of the hair follicles,
right,
and it occurs mostly in the armpits, in the groin area, your
right.
pubic area. Yeah, so it starts off maybe an abscess. You have to drain it. You get an infection. Then the doctor might put you on doxycycline, which is a particular type of antibiotic directed towards hidradenitis, but it's a devastating disease. Occurs around, you know, by the time you're going through puberty. So a lot of these patients have been dealing with it since they were kids, and, you know, it's an odor associated with it. It's really devastating. So the solution for that is cutting out the entire hair-bearing area. You know, when I became a plastic surgeon, because I dealt with it a lot in general surgery, I said I wasn't doing this ever again. But I realized that, you know, you're doing a patient a service with a lot of the disease that you cut out, and I have the ability to, close the wound with plastic surgery techniques.
Sure.
So I actually do a fair amount of that operation as well.
Do you recommend injections or implants for butt lifts or enhancements?
Okay, so I recommend one operation and one operation only, and that's fat injections, which is Brazilian butt lift, which is fat grafting, which is fat transfer. All of that's the same thing. What's not recommended is the black market silicone being injected. So let's clarify this: is that free-form silicone is never safe in your body.
Okay.
It's never safe to inject silicone in your body, period. Okay. It's okay to be inside of an implant. It's never okay to be. So no doctor is ever going to inject silicone into your body. It's just way too dangerous. You cause inflammation. Ladies were dying. They were going to hotel rooms. The silicone beads. They put fix-a-flat in these girls' butts.
My God.
That's the black market side. So 2 operations are approved by doctors, and that's fat injections and butt implants. I don't do butt implants either, because unlike, breast implants, you have a high complication rate.
Sure.
Hardening around it. You're sitting on your butt. You use your butt to do everything. Whether you're squatting, walking, running, whatever. So that's going to cause migration. There's not a lot of good options when it comes to butt implants, but some people are good at them. And I think I probably would reserve butt implants for patients that don't have enough fat to transfer to their butt. If that makes any sense.
It does. And, you asked me, and I was so grateful just for the hour. And you said, you sure we need it? You sure you don't need more than an hour? And I said, I'll take what I can get. It is now 4:53. And I know you've got another engagement at 5. So I don't want to hold you. One more question. 2, what size breast implants per body ratio do you recommend?
So my approach to breast augmentation and implants are, you want it to look natural, right? I don't like putting in oversized implants. I've had a few patients that I've been snookered into putting in, bigger implants than they need, bigger than what their chest circumference can really handle. And I've been bitten by that. So one cup size is pretty good. Yeah, I think that increasing one cup size is.
So it looks neat and nice,
and natural.
Yes.
Even 2 cup sizes is just that you don't want to go beyond what the capacity of what your body structure can handle.
So the body can take, remembering the integrity of the body as far as how you're built and all of that. Because sometimes you can look like a pea.
Yeah, if you're a petite, 120 pounds, whatever, you shouldn't have 700, 800 cc implants. It's just
right.
It's just too extreme.
Yes.
And most people, a lot of people want to go bigger, I think, but most people are happy with moderate size implants nowadays. And I use soft touch implants, which are what we call semi-cohesive implants. They maintain the shape and also feel very natural as well. So,
you know what? I appreciate you, and we're going to have to revisit and have you come back on, because I knew there was going to be questions, and I won't even ask my question. I've asked plenty, but I so appreciate you. It is 4:55, and I want to make sure you get to your next appointment. So we appreciate you. We hold you in high regard. We keep you in prayer. We keep you in the bubble wrap of prayer, because you are certainly an asset to the community, not just the African American community, but the community at large. So I sing your praises every time I see you. Every time it's like, he's a doctor, he's a plastic surgeon. So I thank you for taking the time, even after running into surgery, to do what you had to do and coming on to Life and Style with Francyne. This has been a long time coming. And I appreciate, I asked you a couple of years ago, and it was like, okay, it's coming. And you were like, whatever you need, just don't let me be the first. You said, don't let me be the first guest. So I appreciate it.
Why did I say that?
Huh?
Why did I say that? Do you remember why?
I can't. Do you remember?
I don't know.
I don't know, but I don't know, but I've done about 20 to 25. So you're definitely.
I felt like, I don't know. You already had a buzz back then. I don't know why.
Yeah, well, you know what? At the time, I was just getting started, I think. Okay. And I was identifying people that I wanted to have on the show. And of course, you were one. So I could not. You're definitely a history maker as far as what you're doing, and just being one African American male physician. I'm sorry, plastic surgeon in metropolitan Detroit. Let me remember that. And one.
Two of us. What is her name? I wanted to say Heidelberg, but I'm trying to give props to the other Black plastic surgeon.
That's okay. We lift those up too, and 1 in 150 in
Hardaway, Dr. Hardaway. She got my job here. She got me my job.
Well, shout out to Dr. Hardaway for seeing the contact info. I'll get that. He has to go, guys. I'll put that in the comment section for you all to see, because he's got a 5 o'clock and I don't want to hold him up. So I will
Google me. Just Google me.
Just Google him and I'll get the information. I got you covered. We'll talk to you later, Doc. Love you. Bye-bye.
Take care.
You too. Bye-bye. All right, guys, thank you so much for tuning in. That was an amazing, amazing show. Lots of great information. I'm so sorry we couldn't have him longer. He did have a 5 o'clock, and we started a little later because he had an emergency surgery. We were going to start at 3 o'clock, and we ended up going to 3:30. So we had to do what we had to do. And I'm just glad he was on because he is working. So thank you guys for tuning in to another episode of Life and Style with Francyne. You could follow me on YouTube. Just Google Francyne, not Google. Just do a search in the YouTube box, Francyne Walker. It will come up. You can follow me on Instagram at Francyne Walker TV. And you can go to my Facebook page, Life and Style with Francyne, and follow me there. And if you want to be a guest on Life and Style with Francyne, please drop me a line. Just DM me. You don't have to do an email or anything like that. Just direct message me and we can get you on the show. Thank you once again for an amazing show. Thank you for being amazing guests. Thank you for all the amazing questions. We are definitely going to have to invite Dr. Griffin back on the show for more questions, because we certainly have more questions and he has the answers. So thank you guys. Have a wonderful rest of the Sunday and I'll talk to you guys soon. Thank you guys. Thank you. I love you all for your support and continuing to watch, and I'll see you guys soon. Mwah. Have a great day.